My name is Sam Simberis. I'm a clinical psychologist. I'm the founder of Pathways to Housing. Uh, I'm currently working with the Pathways Housing First Institute to disseminate the Pathways Housing First model nationally and internationally. And I work with communities and organizations and cities that are looking to end homelessness for people that have been homeless for years and have contact with criminal justice and other institutional settings across the country.
Hi, my name is Christy Respress. I am a social worker by training, and I'm the executive director at Pathways to Housing DC. And I have worked with Pathways for over 20 years now. In my current role at Pathways to Housing in Washington, DC, I oversee a program that serves about 3,000 people each year who are experiencing homelessness or at risk of homelessness through our Housing First programs, our street outreach, and also our work in the DC Superior Court to provide urgent mental health and addictions treatment. I've also done a lot of work to support and train other communities locally and also with Sam sometimes nationally to help people who are moving towards housing first to head in that direction.
Housing First is a rather easy to understand intervention because in the label, the definition is evident. It means that people who are homeless and in need of access to housing, and this is a population of people that also would need some support in addition to housing, are given the opportunity to move into housing first, immediate access to housing. And that group of people is also provided with comprehensive wraparound supports in order to be able to manage the housing and achieve a higher quality of life and community integration. Housing First is best known for this particular aspect, from the streets or out of jail or out of hospital directly into housing. What is less understood about Housing First is that it is actually about people. I think in some ways, Housing First would be better named if it was called People First, because the program fundamentally is a commitment to work with each individual person so that there is a change in their life from the pattern that had led to homelessness or recidivism in institutional care to a life of stability in the community. Housing First separates housing from treatment so that people are offered housing without preconditions for sobriety or mental health treatment. So this idea of harm reduction, putting someone into housing and then reducing the risks associated with drug use, for example, risks such as health risks, recidivism back into the criminal justice system risks. Harm reduction is essential as a practical approach to being able, first, to house people, and secondly, to keep them housed as they work on their sobriety or health issues. So it's an integral part of the program. You can't really have Housing First without a harm reduction approach. One of the challenges in harm reduction is that much of the criminal justice system is a sobriety-based system, so that the harm reduction approach also works with educating other community partners working with the same individual to have a more flexible approach to use, abuse, and the consequences of people struggling with addiction. So helping the entire community to move to a harm reduction perspective rather than arrest, we're more focused on treatment. But it's an integral part of the mindset of the Housing First program, both in housing and treatment and working with other systems as well.
In our experience of Pathways to Housing, we know that for actually about 80% of the people we serve in our programs have some interaction and often are the highest interactions with the criminal justice system. What we see and what research actually also proves is that once people have access to the housing, that recidivism back to jail, back to other institutions actually goes down, because people have a safe place to call home where we can actually find them and offer those other wraparound services that we provide in a housing first model. We know, and Sam mentioned, that the housing first model means that we don't require, pre-treatment to get into housing. But that's helping people get in. The other thing that is really exciting, and where I see the impact on the pre-arrest diversion side of things, is that many people with involvement in the criminal justice system have a very difficult time even getting into housing because of their landlord requirements, their history of arrest, et cetera. So having a housing first program where we have staff dedicated to also not just providing the services, but educating and working with landlords and other community members to help people transition into housing is really critical, and I think a really important component of the housing first model. So what we see is that once people, and again, research has repeatedly shown this, but also our experience is that once people are able to have a stable place to call home, and the housing first piece of it, that first piece is just the beginning, right? If that someone chooses housing. But the real intensive work happens next with people is around helping them address the really complicated health problems they might have. Mental health challenges, addictions challenges, and physical health challenges as well. So the housing first approach is not just housing only. It is very much those wraparound support services. And we know that some of those things are the things that often are leading to the arrest again and again, the recidivism, the addiction, the mental health that's untreated. So providing people with those intense wraparound supports while they're in housing, people are much more successful than trying to do that while they're still experiencing homelessness or are unstably housed in the community. So we see really dramatic results in terms of people's overall health and well-being, as well as connection to the community. The other piece that it has an impact on is people's ability to gain employment. Again, once people have stable housing, not just mental health and addiction treatment, but also connecting people to employment, recreating social networks and family supports are the other critical services provided. And those things are all absolutely critical to having a healthy community as well as individual health. For the Housing First program to be successful, we engage many, many community stakeholders in ultimately whatever system or system that touches the life of the person that we're working with. So for people who are involved with the criminal justice system, we have a lot of interaction with parole and probation, with judges, attending court with people, explaining the supports, the system. We also work very closely with police departments while people are experiencing homelessness, but also after that in terms of educating on best practices, educating on the mental health side of things and the addictions treatment and what the services are that are actually being provided to people in the Housing First program. But the stakeholder engagement is really, really important. It is not done in a vacuum. The work is not just provided in someone's home, but truly as a part of a whole community approach.
The community engagement, I think that diversion is best thought of as a community decision because the participation that Christy describes of the criminal justice system, and I would include probation and parole in there, but it also includes community landlords and it includes community health clinics. There's a philosophy in diversion which is founded on a harm reduction approach, right? It's really the idea of the landlords not being quick to report or evict, but to bring in case management to support. So it's a community mindset shift that looks to support rather than punish. So I think that the diversion program may begin specifically with criminal justice or a housing and support service program, but to really be successful throughout the community, all of the stakeholders need to be educated in the model and participate with the same practices and values. I would say community landlords are particularly valuable partners in that. Programs that are going to be successful need to think about long-term commitments to people. This is not a short-term intervention, and that, a program that works at diversion may initially not succeed. There may be a rearrest, but that should not result in discharge. That should result in continued support through that particular trial, and then that the agency would be there to support the person after that. It's not a perfect intervention. So you don't achieve permanent housing stability or the end of criminal justice involvement in a one trial learning. I mean, part of harm reduction is repeated failures and how you deal with the failures so that people don't get discharged, but get supported to learn better from the next trial. So the long-term commitment with that philosophy continuing throughout is what builds to success.